Hello viewers, welcome to Janshakti Network. Do you know that in India, the out-of-pocket expenses for health, that is, the amount people must pay directly from their own pockets, stands at 45.98%, and this cost is continuing to rise. Across the country and in our state, the cost of medical treatment and the price of medicines are comparatively much higher than in many other countries. In nearly every family today, the largest monthly or annual household expense is on medicines. We all know that in our country, people have to purchase healthcare services. It is not provided as a citizen's right. So the question is, what is the government doing? Why are medicine prices rising again and again in our country? To understand the reason, let us look back for a moment. For clarity, we can divide the timeline into several phases based on drug pricing policy. Before the 1970s, the Indian pharmaceutical sector is considered the policy vacuum period, an era of no proper regulation. At that time, MNCs dominated the Indian drug industry. Because of colonial era patent laws, medicine prices were extremely high. Most drugs and formulations were imported, while Indian companies were involved only in repackaging. Then came the phase from 1970 to 1990, the era of government policy. In 1970, the Patent Act was amended. Product patents were replaced by process patents. This meant multiple companies could manufacture the same medicine using different processes and sell it in the market. Competition led to a reduction in medicine prices. Next, in 1974 to 75, the central government formed a committee to regulate drug prices, oversee pharmaceutical production, and determine fair pricing. This was the Hathi Committee headed by Rajya Sabha MP Jai Suklal Hathi. The report stated that medicines of proper quality must be made available to ordinary people at low cost. Following this, the government introduced the Drug Price Control Order. Now let us look at another aspect. Based on usage, medicines are divided into three categories. Category 1, essential drugs. Category 2, highly important drugs. Category 3, the rest of the drugs. In 1979, the MAPE or Maximum Allowable Post-Manufacturing Expenses for Category 1 medicines, meaning the maximum allowed costs after production, was 40%. In 1987, it rose to 75%. By 1995, it reached 100%. The same trend was followed across other categories as well. During the liberalization period, India joined the TRIPS agreement in 1995. Policies changed, foreign investment increased, public sector pharmaceutical units were shut down or sold off, and Indian MNCs emerged. Because of TRIPS, product patents were reinstated. This meant that from 2005 onwards, when a new medicine is invented, the company owning the patent receives a 20-year monopoly. No one else can manufacture that medicine, which means if the patent holder wishes, they could sell a medicine worth Rs 5 for Rs 50,000 without anyone being able to object. As a result, newly developed medicines in the future will reach terrifying price levels in our country. So the question returns, for whom are these policies being created? To ensure ordinary people can access cheap medicines, or to increase the profits of pharmaceutical company owners? In 2013, a major shift took place. Until then, medicine prices were determined based on manufacturing cost. That system ended and the market was given control. The new rule in 2013 stated that the average price of all companies holding at least 1% market share of a particular drug would become the maximum retail price. It was also declared that except for the essential medicines list, the prices of all other medicines could be increased by up to 10% annually. Let us also see how price control expanded or shrank. In 1979, 80 to 90% of all medicines in the market were under price control. By 1987, this dropped to 60 to 70%. In 1995, it further fell to 25 to 30%. By 2013, it had declined to around 20%. Each time, the proportion of controlled medicines decreased, meaning the number of unregulated medicines increased. Pharmaceutical companies gained even more freedom to raise prices. So now, think about it yourselves. These government orders were meant to be called drug price control orders, intended to reduce prices. But what actually happened? Policies were designed in such a way that it became very easy for pharmaceutical companies to increase prices. This is why, today, as people struggle under soaring drug prices, they are demanding that the dpcO be properly restructured to bring medicine prices down. They are also demanding a return from product patents to the process patent regime of 1970. Only then can medicine prices truly be reduced. To make healthcare accessible, we must fight collectively and compel the government to listen to the people. What do you want? Do you agree with these demands? Write and let us know. We will return with another episode discussing the rising cost of treatment and medicines. That is all for today. We'll come back with more later.
Don't forget to like, share, and subscribe to stay updated with the latest incidents. Hit the bell icon to never miss an update. We will see you next time with more news that matters. Stay informed, stay safe.